You know, when we're dealing with the symptoms of chronic pain, it's really imperative to distinguish the signs and symptoms of fibromyalgia from other chronic pain syndromes. In order to do that, we really need to understand some very basic things about this condition. For instance, the most common symptom is diffuse pain with achiness, stiffness, and extreme tenderness in the muscles and points where the ligaments attach muscles to bones. Although pain may occur widely in many areas of the body, specific sites of tenderness, simply referred to as tender points, typically occur. These tender points can occur around the neck, shoulders, upper back, lower back, and the hip, and even the knees. Another common symptom is fatigue, characterized by a lack of energy, a lack of enthusiasm, and an overall lack of endurance. Other symptoms related to fibromyalgia may include sleep disturbance, coldness in the hands or feet, along with discoloration of the skin, bluish or reddish, associated with poor circulation, sometimes called Raynaud's phenomenon. Migraine and tension headaches are common. Abdominal bloating and alternating diarrhea and constipation, muscle tremors and blurred vision, emotional stress, anxiety, fatigue, and cold or humid weather, which actually aggravate the symptoms of fibromyalgia. Now, the universal symptom of fibromyalgia is, in fact, pain. As I mentioned earlier, the pain in fibromyalgia is not caused by tissue inflammation. Instead, these patients seem to have an increased sensitivity to many different sensory stimuli and an unusually low pain threshold. Minor sensory stimuli that ordinarily would not cause pain in other individuals can cause disabling, sometimes severe pain in patients with fibromyalgia. Now, the body pain of fibromyalgia can be aggravated by a lot of things like noise, weather change, emotional stress, but in general, the pain of fibromyalgia is widespread. Fibromyalgia tender points are sometimes incorrectly referred to as trigger points, which is really terminology that is used to describe a situation whereby pressing on certain specific points can initiate a sequence of symptoms. This is not the case with fibromyalgia tender points, which are chronically a focus of pain and tenderness in the particular area involved. Now, the fatigue I referred to earlier occurs in 90% of patients. Fatigue may be related to abnormal sleep patterns commonly observed in these patients. Normally, there are several levels of depth of sleep. Getting enough of the deeper levels of sleep may be more important in refreshing a person than the total number of hours of sleep. Now, patients with fibromyalgia lack the deep restorative level of sleep called non-rapid eye movement or non-REM sleep. Consequently, patients with fibromyalgia often wake up in the morning without feeling fully rested. Some patients awaken with muscle aches or a sensation of muscle fatigue, just like they've been working out all night. Now, mental and emotional disturbances can occur very frequently in over half of all people with fibromyalgia. These symptoms include poor concentration, forgetfulness, mood changes, irritability, depression, and anxiety. Since a firm diagnosis of fibromyalgia is very difficult and no confirmatory laboratory tests are available, patients with fibromyalgia are often misdiagnosed as having depression as their primary underlying problem. Other symptoms of fibromyalgia include migraine and tension headaches, numbness or tingling of different parts of the body, abdominal pain related to irritable bowel syndrome, spastic colon, and irritable bladder, causing painful and frequent urination. Each patient with fibromyalgia is very unique. Any of the above symptoms can occur intermittently and in different combinations. Now, the good news is that many scientists are now very interested in researching the role that the central nervous system may play in fibromyalgia. Even though prescription medications are available to treat the unique pain of fibromyalgia in the short term, the long-term solution ultimately lies in identifying what causes fibromyalgia in the first place. This question is discussed in detail throughout this series of videos. You know, over the years I've treated hundreds of fibromyalgia patients, and they've all asked me very similar questions about living with fibromyalgia. So if you've found this information valuable and you'd like to get the rest of the 20 frequently asked questions, then go to www.answerstofibromyalgia.com. In addition to these videos, I'm going to send you my Fibromyalgia Roadmap, a visual guide to controlling the symptoms and minimizing the discomfort of this disease, including what you should be doing over the next 90 days. This is Dr. Richard DiCenso, and here's to your health.